วัสดีค่ะ So welcome to the Living Well program by Bangkok Hospital Phuket. So you are here with us, and today very special program that we are going to talk about the dental problem in children. So we are here with our doctor, our pediatric dentist, Dr. Rungsima Leelaprute.
สวัสดีค่ะ I'm Dr. Rungsima Leelaprute, or you can call me Dr. Apple. That is quite common for our patients when they come to see me, so they call me Dr. Apple.
Oh, I think the children will love to come and see Dr. Apple, right? So when should the children first see the dentist?
Actually, the children should come to see the dentist whenever the first baby tooth is coming up at the age about 6 months old.
Oh.
You know why? Because a lot of parents will confuse that, their child or the children are still so young, that age is very young, so why they need to come to see the dentist?
Yeah.
But I'm going to tell you that the first time that the children come to see me or see the pediatric dentist, normally they will just come, we just check it roughly, not more than 5 or 10 seconds, very fast. If everything is fine, we just give the parents the information about the oral hygiene or how to take good care of their kids' teeth and everything like that. So the children will, get used to everything, get used to me, get used to the pediatric dentist, get used to the equipment, atmosphere and everything. So they will be good, even in the first time or when they are very young, they still cry, they're still afraid about everything. That is normal for that age because they are still young. But when time passes, they will know, they will learn that everything is very normal, it's no pain, everything is good, so they will be better, much better than the others who never come to see the dentist.
Okay, they should take this experience, right? So you did say like the first baby teeth is erupt by which age?
About 6 months old.
6 months old. And what you usually do when you see them the first time?
The first time, as I told you, that we just they just come with parents, and we just check with mommy's lab and my lab together. We help together, and then after I check, and if everything is good, I mean normal, nothing's wrong, we can I will give the parents the information how to take good care of their teeth if there's nothing wrong. That is so important. And after I give them the information, sometimes the parents will have got a lot of problems or a lot of questions to ask me. So we can give them the answer or the information how to take good care of their kids.
Yeah, I think so too, because actually for the first kids, maybe that's the most important time, not only for the kids but also for the parents.
That's right.
Yeah,
that's
very
right.
excited to bring the kids the first time to see the dentist.
That's right.
And what about the baby teeth? Are they important? That important?
Sure. This is the good question actually, because a lot of parents they say that that is just a baby tooth. Why do we have to put more attention or we have to take good care? Because one day in the future, and not very long future too, they will fall out naturally.
Yes.
So I will tell you that the baby tooth, there are a lot of duty. The important duty of the baby teeth, and they will relate with the relationship with between the permanent tooth and the baby tooth. And one of the main duty of the baby tooth is to keep the space for the permanent tooth to get erupting in the good position. That is so important. So if you don't take good care of the baby tooth, if there is a cavity, there is an infection, you have to pull out the tooth before the proper time. It can be possible that the tooth behind and the back of that tooth will be moving forwardly. And when the time which the permanent tooth should be erupting in the good position there is not enough space for that tooth to come up in a good position.
I see.
And the occlusion for the permanent dentition will be wrong. So that will be the big deal or the big problem in the future.
Then they need to come and see you again, right? So
and that will be
as I
hard, you know.
very good information, because since I also a mother of a child, then I think actually it just a set. A baby teeth is like a set that I told him that you have time to practice to take good care of your teeth. With the first set. After that, you're gonna have to spend the whole life with the second set or the permanent one, right? So I just think they're gonna fall out anyway, but I think that is very good information to know. So what's normally you found as a dental problem in children?
Okay, normally the dental problem can be from the cavity or the holes in the tooth, or the gum inflammation, the trauma, or the disease inside the mouth, in the oral cavity, in the for the disease of the oral mucosa or something, just like cyst or something. But okay, you may not see it normally, but normal you will see the cavity or the gum inflammation. That is the major problems of the children.
What can make them happen? This kind of disease, like gum inflammation,
and cavity or the holes.
Yes.
Okay, the very important problem is the taking care. How they take care of their teeth, or you brush your teeth or clean up your teeth. How you clean up your teeth every day. That is so important. So a lot of parents they have got the big problem about clean up their kids' teeth, because a lot of kids they are scared, they are crying, or they don't like to clean up their teeth.
They don't like the taste of the toothpaste, maybe.
It can be possible. So or it is normal for the very young children not to allow the parents to brush your teeth, but you have to know how to. Okay, you want to know?
Maybe you are going to ask you. Maybe you can suggest us how to take care of their teeth, or how to help them, or teach them to take care of their teeth.
All right. Okay, I will explain for you for the how to take care or how to brush the kids' teeth for the very young kids only. Okay,
how old?
Because that
kind of.
Actually, you have to start to clean up in the mouth. Actually, at the first day, in the first day that.
The first day, okay, you have to listen carefully. Okay.
I don't mean brushing. I mean clean up. You have to use maybe the gauze or the soft cloth.
The soft cloth.
And with the normal saline, okay, to clean up the mouth or the gum, the tongue, the palate, and everywhere inside the mouth after they drink milk.
I see.
But after the first tooth or the first baby tooth is coming up at the age about 6 months old, as I told you, you have to start brushing their teeth with the normal toothbrush and normal toothpaste. I mean the toothpaste which has got the fluoride.
I see.
That is so important. Even the first tooth is coming up. How to clean up is like you have to, mommy or daddy, we have to sit on the floor.
Sit on the floor.
Straddle your legs.
Okay, spread the legs.
Your kid will lie down on the floor too.
Okay.
And the head or the head should be in your crutch,
Okay.
or in your lap.
Okay.
And if they are moving, maybe you have to lock your cross your leg over them.
Lock with love. Okay.
And or else if they are moving a lot, you can use just like the big blanket.
I see.
Hold them, to wrap them actually. Okay. And then you cross your legs over the blanket again. But you will know how
to control your baby, how to control your kids.
And then one arm you just lock the head, and the other hand you just brush the teeth. You clean your toothbrush properly first, and then squeeze the toothpaste just a little bit. Okay, just like a little the small pea. That's it.
Okay, pea size.
Yeah, pea size. That's it. And then when you brush, you just brush like this.
Okay.
You do it gently. You press it a little bit. And do it gently. Okay, backward, forward, backward, forward. Just very, very gently.
Backward, forward.
A long time. Yeah. 1, 2, 3, until 10. And then you move one by one from one tooth to the other tooth, and until from one side and to the other side too.
Okay.
Outside and inside as well.
Okay.
For the back teeth, you have to brush on the top of the teeth too.
Okay.
Like this. Like this. Okay. Like this.
Do we have to brush down or just left and right?
For the very young kids, you just brush like this.
Okay.
Okay. Inside too, you just brush in the same technique. Like that.
Maybe we sing a song till your time cleaning that teeth.
You should brush, long enough time to be clean enough. And the important thing is, if you can use the dental floss, you should use it too. Okay. I mean, whenever the tooth has got the proximal area, you have to use the dental floss too, because the brush can brush just only some part of the tooth, but in proximal sides or between the teeth, you cannot use the toothbrush to clean up properly, so you have to use the dental floss every day too.
Okay. So what about the kids that they have kind of problem that they have to come for orthodontic? When should they start, or when if their parent check, and when should they come and see you? Which age?
Alright. First of all, I have to tell you first that for the children, they should come to see the dentist every 6 months anyway.
Every 6 months?
Every 6 months, that is so important, okay? And whenever the pediatric dentist or the dentist can see that your kids have got the problem about the occlusion, okay, we will try to tell the parents. And some problems of the occlusion can be fixed before the all of the permanent teeth are erupting. But some problems we have to wait until all of the baby teeth are falling out and the permanent teeth are coming up, all of them already. So it depends. It depends on what type of the problem that the children get. I cannot tell you exactly how what age is the proper age or the proper time to get the orthodontic treatment or the braces, because as I told you, it depends.
Okay, the answer is very clear, because as you just said, we should come first time when the baby teeth is erupt, or the first is like 6 months old, kind of average, and after that every 6 months come and see the dentist. And our dentist will identify, and give some suggestion when and what should we do to prepare the best space for the permanent teeth, right? Okay. So what kind of suggestion about? Okay, you did told us something about oral hygiene. But how about the also diet, like the food, the meal for them?
Okay. I forget to tell you one more thing. For the cleaning up, okay, after you clean up all of the teeth already, okay, you just maybe use another cloth to or another gauze to clean up inside the mouth again. Okay, for the teeth, you can use that toothbrush. But for the area that the tooth is not erupting yet, maybe they are very young.
Gum.
The gum. You can use the cloth or the gauze, the wet ones, to clean up inside. And and you have to brush the teeth 2 times a day at least. This is so important. In the morning time and before going to bed, and after brushing in the night time already. The kids should not eat anything or when the kids are over than 1 year old. So you should stop. They should stop drinking milk in the night time. So after brushing in the night time already, nothing.
No food, no milk.
No milk.
Just water.
Fresh water.
Okay,
that's it.
Fresh water.
And use the dental floss for them every day, once a day. That's okay. For the diet, as you asked me, I suggest the patient to eat in the meal time, you know, because a lot of children and a lot of families, they just feed their kids all the time, and that is not so good, you know. They just feed them in the meal time, you know, for sweets, something sweet, chocolate, just like chocolate or ice cream. For me, I think it's okay. I think it's okay for the children because they are children.
Yes.
They love that, so that's okay. But you have to know how to give them, and you have to know how to clean up properly afterwards. That is much more important than quit it.
Like after chocolate, should they goggle? Should they wash the mouth? Kind of.
They should, first of all, eat in the meal time, and every meal should not be too long. You know, for a lot of children, they just when they chew for a long time, and sometimes they don't swallow for a long time like that. If that habit can make the cavities or the gum problems too for the children too. So they should not eat for a long time. Just eat in the meal time, and sweets just like chocolate after the meal time. And after that, you gargle like you said, and after that, just brush the teeth for them. That's it. That's it. That is so easy, and win-win for everybody.
I think since I've been talking to you, it's very good atmosphere, and I'm sure that the children will love to see you as well.
Thank you.
And how often do they have to clean and polish their teeth?
With the dentist, right?
Yes.
By the dentist, every 6 months. That is the time that the children should come to see the dentist every 6 months. Anyway, we will shake, clean, and give them the fluoride. Normally, we will give them the fluoride application. The fluoride is so good for the children because it is the chemical stuff that is quite, for me, it's quite miracle. You know, it's a miracle for the health, for the dental health. It will resolve inside into the tooth, and it can change the ingredient of the tooth to be stronger to fight off the cavity or something. So it will be stronger. That is so important. So we just come see the dentist every 6 months, and
every
do
6
that.
months. May I ask a classic question?
Yep.
What's the problem if our kids love to suck the thumb? Thumb sucking problem. Yeah.
All right.
I think maybe many family has this problem.
Yes. Actually, you know, for thumb sucking, actually, it is quite hard for the parents, even for me, because you know a lot of families, they ask me about that, how to quit that. That is so important, and it is so hard how to, because and for this question, a lot of parents they ask me too, and sometimes I have to ask them back too, how you prepare or how you control this habit.
Maybe some already tell you.
Yeah, so I can tell this technique to others too. You know, it's so classic, but it's quite hard. You know, first of all, if the children are older enough or old enough to know, so we will try to explain them why you should not suck your thumb. First, obviously it's dirty, you know.
Yes.
It's dirty.
It should be in a proper place, not in the mouth.
No. So put it inside a lot of bacteria, a lot of bad things inside your mouth. Maybe when you explain to the children, you should not. You may not explain like the very
hardcore.
No. I mean hard words or something. You try to explain in the very
reasonable way,
simple way for the children to understand. Like first of all, it's dirty. When you suck that thumb, that means you suck the bacteria or the bad things
into their mouth.
secondly, when you suck the thumb, your teeth can be in the wrong position or the wrong direction or the wrong alignment. Normally for the thumb sucking people, they have got the protruded the front teeth.
Yes.
The front teeth, especially in the upper tooth, like that. And sometimes it can affect the bone on the top too, the maxilla.
Maybe we have to show them some picture.
Yeah, sure. We have got the picture, or you can search the internet and then show them that this is quite this is a bad thing or the bad habit for you. If you do like that, you get something like this, and it's not beautiful.
Okay.
Will not be handsome or not be beautiful.
Maybe in the near future, we may have to come back and see you again, because I'm sure if there are any questions, you can also note down on our Facebook page, like Bangkok Hospital Phuket, on our Facebook page, or also you can observe the World Wide Web PhuketDentalCare.com, PhuketDentalCare.com, and come visit us. We also have a Thai website, โรงพยาบาลกรุงเทพภูเก็ต Be healthy, be happy with us. So thank you very much and living well. Have to leave you today. Okay, see you next time. Bye. สวัสดีค่ะ Thank you, doctor. ขอบคุณค่ะ Thank you.